What is breast cancer? You may know that Breast Cancer Month awareness is in October and that the ribbon used to symbolize it is pink. But do you know how to prevent breast cancer? What causes it? That it can also occur in men? Awareness is key to one's health, and as public as the topic has become, many still do not know what breast cancer is and how to prevent it. Breast cancer ties in with lung cancer as the most common cancer globally, with an average of 2 million cases each year. There are two risk factor categories, a genetic category and an environmental category. Genetically, women are 100 times more likely to get breast cancer than men. Of all women, breast cancer is most common in Caucasian women compared to all other races. In addition, family genetics matter, and if there is history of breast cancer in your family tree, you are at a higher risk to get it. Environmental factors are much broader. These factors can include poor diet, obesity, hormone replacement therapy, a sedentary lifestyle, and radiation therapy to the chest before the age of 30. Overall, many of these risk factors are preventable, and the cancer can be caught on early if you stay aware of your genetic and environmental predispositions. Ideally, prevention would be key, but that is not possible at times. The next best thing is catching breast cancer early. In fact, there are two ways to stay aware of your body. Conducting breast self-exams at home can be done regularly and for free. It is easy to find many tutorials online, and there are apps available to help you stay on track. Mammograms are more successful than breast self-exams. In fact, mammograms can find breast changes that could be cancer years before physical symptoms develop. Typically, mammograms are recommended for women 40 years old and over, but those who are younger also have the option, especially if you have a genetic predisposition. The mammograms are to be conducted every year at a doctor's office. Finding the cancer before it sets in can help prevent the need for aggressive treatments such as surgery and chemotherapy, which can leave behind long-term effects. The best way to stay on top of your health is to avoid risk factors and conduct self-exams and mammograms. But what happens if you acquire breast cancer? With breast cancer come physical, emotional, and psychological changes. Both the treatment of the cancer and the cancer itself leave behind long-term and short-term effects on the individual afflicted. Doctors will typically prescribe treatments specific to your body, and treatment effects may vary person to person depending. Usually, however, a person diagnosed with breast cancer will undergo chemotherapy and/or surgery. Scarring is quite common. Radiation treatment and surgery leave behind scars and skin discolorations. Most commonly, scarring affects one mentally. It can be hard for a woman to feel confident in her body, and takes time for her to embrace her new look. Plastic surgery and tattoos can help alter the scarring, but the most common way of dealing with it is acceptance mentally. Hair loss in the eyelashes, eyebrows, and pubic region can also occur, and this effect is largely attributed to chemotherapy. That's why many choose to shave their heads in support of those afflicted with cancer. This side effect is usually temporary, and the hair will eventually grow back. Such a harsh illness such as cancer is very draining, mentally and emotionally. Many women have a loss of self-confidence in a large due to their own perception of their body and societal pressure to look a certain way. The best way to battle these symptoms is to surround yourself with support of family, friends, and to accept yourself. So far, the discussion has leaned heavily into the female gender being afflicted, but in fact, men can get breast cancer too. This is in turn due to male and female bodies sharing similar breast cells and tissue. Less than 1% of all breast cancer cases develop in men, and only 1 in 1,000 men will ever be diagnosed with breast cancer. However, as small as the number may be, it is important to spread awareness of the fact that men can develop breast cancer as well. A man is less likely to assume a lump is breast cancer, which can cause a delay in seeking treatment. Breast cancer has many risk factors, extensive and intense treatments, and can be very hard to deal with mentally, physically, and emotionally. But awareness is key. It can help those who have breast cancer and allow their close family and friends support them. Spreading awareness is the next best step in battling and preventing breast cancer.